Today on COVID-19 Mythbusters, we explore an important question. Is there a connection between receiving the COVID-19 vaccine and getting blood clots? Stay tuned. We're joined by Dr. Ramon R. Scott, who will be sharing everything you need to know about the topic. COVID-19 vaccines have been shown in clinical trials to decrease the risk of serious illness from the coronavirus disease. But many are worried about experiencing side effects in the long and short term. One of the effects that has been reported is an increased risk of experiencing blood clots. According to the Mayo Clinic, blood clots are gel-like clumps of blood that are beneficial when they form in response to an injury or a cut, plugging the injured blood vessel, which stops bleeding. Blood clots are a natural response to physical trauma, but they can be challenging when they're undetected in the body with illnesses like deep vein thrombosis, which occurs when a blood clot forms in one or more of the deep veins in your body. These types of blood clots are concerning, and as they are noted as a side effect of being vaccinated, persons are afraid that they may experience this condition. But how frequent is this really? And what is the connection between vaccines and blood clots? Dr. Ramon R. Scott, plastic and reconstructive surgeon with a PhD in immunology, gave us some insight on how COVID, vaccines, and blood clots are related, and whether there are treatments available for this issue.
You know that if there are side effects based on decades of vaccine data, it usually happens in the first 6 weeks. We've been vaccinated for over a year now, right? In terms of from the studies till now. And they hadn't seen any. And then right on the back end of March, middle of March, they say, what about this clotting thing? Is the vaccine causing these clots and all? Should we pull back? The reason why they hesitated in the beginning to say it was the vaccine that was causing it is because SARS-CoV-2 causes clotting. They were trying to determine, is it the vaccine that caused it, or did the person get the hat and then caught COVID afterwards before they got their second shot, and that's what caused it back? To give you the data, if you catch corona currently, you have a 1 in 12 chance of getting a DVT, a clot in the leg. You have a 1 in 12 chance of getting a PE actually in the lung, clot in the lung. 1 in 9 in the leg. Okay? If you get sick enough to end up in the ICU, God forbid, 23% chance of getting a clot from the infection. That's 1 in 4. If there was a clot to come from the vaccine, they estimated it would be 1 in 250,000 is the chance. Maybe 3 to 4 in a million might get a clot. And just like in the beginning when they were struggling to figure out how to treat corona, they've now figured out what are the causes of the clots and how to treat it. So it is as rare as being hit by lightning compared to the 1 in 9 or 1 in 4 of getting it if you caught the infection. So the infection is way, way, way more likely to give you a clot than the vaccine. And if you're the 1 in a million person that might get it, they got the treatment for it. And they know how to test for it as well. Bottom line is the infection causes clots way more. And the vaccine is extremely, extremely rare.
In other words, 1, you are more likely to get a blood clot from contracting the COVID-19 virus, in comparison to getting blood clots as a side effect of being vaccinated. 2, it is actually quite rare to get blood clots from vaccines. 3, serious side effects from vaccines usually happen in the first 6 weeks after being inoculated. And 4, if you were one of the rare persons to experience this side effect, there are tests and treatment available. The risk is far greater for getting blood clots from COVID-19 versus from being immunized against the virus. Consider this when making your choice. If you've made the decision to get vaccinated, visit the Ministry of Health's vaccination website at vaccination.moh.gov.jm, social media on Facebook, Instagram, or Twitter, or contact the ministry at its hotline at 888-1-LOVE. Get vaccinated. Get back to life.